Oh, yeah, I'm ready. Imagine having a cold and sharp blade pierce the medial of one of your eyes and then having it proceed into your frontal lobes of the brain. From there, with a clean swiping motion, it severs the lobe from the rest of the brain, and just like that, you're a completely different person. In this paper, I'm going to inform you about the medical procedures of the lobotomies, who they were performed on, where they were performed, and who administered them. I feel comfortable speaking about this topic because I learned about it in both of my psych classes, and I also did a lot of research after that. I will first discuss what a lobotomy is. In 1936, Walter Freeman took the idea of a leucectomy and twisted it into his own idea, which he then called a lobotomy. A leucectomy is a drilling holes into one skull, but Freeman wanted to make it a lot more simpler. That was the new procedure. Yeah, okay, now we have a new procedure that came out and called the deep brain stimulation. In this procedure, a surgeon drills holes into the head and inserts electrodes into the neural tissue. This is a more cleaner way of doing it and damages a lot less tissue. This procedure is still used, but it's only for the most severe cases of OCD and other diseases like Parkinson's disease. Freeman's lobotomies were described by an eyewitness as, those who watched the procedure described it as, a patient would be rendered unconscious by the electric shock. Freeman would then take a sharp ice pick-like instrument, insert into above the patient's eyeballs through the orbit into the frontal lobes of the brain, moving the instrument back and forth. Then he would do the same on the other side of the eye. After the procedure is finished, the patient was left in zombie-like mode. People would describe this patient's face as lifeless. Many were calm because the frontal lobe was detached from the rest of the brain. The frontal lobe is the most complex lobe and is charged with complex thinking, planning, math skills, and emotions. Next, I will go over why lobotomies were performed. There was many reasons why lobotomies were performed, but the three most important ones were because of the mental disorder of schizophrenia. Schizophrenia had everything to do with the frontal lobe. The frontal lobe controls behavior, social adjustment, impulse control, and emotions. Schizophrenia is one of the many brain diseases that include delusions, loss of personality, confusion, agitation, social withdrawals, psychosis, and bizarre behavior. Lobotomies also helped out with the disorder of OCD. OCD could have completely been treated without this procedure, but what OCD is shortened for obsession compulsive disorder. Causes severe anxiety in those affected. OCD involves both obsessions and compulsions that take a lot of time to get and get in the way of important activities of personal values. Finally, there was no reason at all. Some patients would undergo the lobotomy for such little reasons as mood swings, fighting with a parent, not wanting to take a bath, or just being too hyper. Finally, I will discuss what happens after the okay for the procedure that was given. Many people had mentioned that it did impeccable things to help them get through their time of need, and but there was also horrible things that came out of lobotomies. I will mention both. Some successful stories on other experiences was Anne Kusbach. She claims the procedure of a lobotomy helped her enormously. And claims the lobotomy procedure had helped her enormously. The second was Howard Dooley. He first had horrible outcomes and managed to pull his life together. Dooley had a lobotomy for no reason at all, other than he did not get along with his stepmother. He took decades to actually heal and became homeless and an alcoholic. He finally then pulled his life together and got a college degree and has a really good job. Some not successful personal stories on others' experience was President J.F. Kennedy's sister, Rosemary. She was 23 and required total control over for the rest of her life. She was said to be mentally retarded, but she ended up not being, so the procedure was done for no reason. As you can see, there was a dangerous procedure that was helpful to some and not others. So today we discussed what a lobotomy was, why it happened, what came out of the procedure, and some stories of experiences that happened with this procedure. I got my facts from the EBSCO website off of Hawkeye. It was FYI for your information. It was done by Daniel Edberg. I also used a lobotomy that says didn't touch his soul to find out about Dooley. I also used the do-it-yourself lobotomy. I also googled what is obsessive compulsive disorder and what is schizophrenia. As I mentioned earlier, the speech was over how lobotomies were carried out, who carried them out, why they were carried out, and who had this procedure done to them. So could you imagine this happening to you? An ice pick stuck in your eye socket and coming out of the procedure a completely changed person? And this is to show you again what the visual aid was. This is the procedure being done. Thank you.